Hi, I'm Dr. Swee-Ling Levea. I'm one of the transplant nephrologists at UT Southwestern. Today I'll be talking to you about the benefit of living donors. When we're talking about living donors, there are several options for different individuals. We have what we call living-related donors, which primarily could be brothers, sisters, parents, or cousins who would like to donate a kidney to you. From a living unrelated, it could be anybody like a friend, a spouse, or a church member, or even a co-worker. Now, if neither one of these are an option, we always have the third option, which is in the pair exchange, where you have a living donor who may not be compatible to you, so you enter a system as a pair. In this way, you can basically do a two-way swap where your donor is compatible with another recipient, and their donor will then basically exchange with you. As you can imagine, with this, we can potentially do multiple different swaps at the same time. What are the benefits of living donor? We have better results, better kidney and patient survival statistically than deceased donor kidneys. We have better health. Recipients is transplanted sooner when the recipient is actually in a better overall health because this can be scheduled ahead of time. And better quality, less time between the removal of the kidney from the donor and the transplant into the recipient kidney typically functions immediately. So we have less rejection with fewer complications as well. And last but not least, better prepared. It's an elective surgery, so you can schedule it in the convenience of the donor and the recipient, which means that they are both in the best condition, as you can imagine. Now, who can be a potential living donor? A living donor has to be at least 18 years old, and we can see someone all the way to the age of 74 years old. And they have to be willing and prepared to undertake the transplant process. And they have to be in a good mental and physical condition. So some condition disqualifies a potential donor from being a potential applicant, things like diabetes, needing more than 2 medications to control their blood pressure, a combination pills, which counts as 2 blood pressure medications, and then severely overweight with a BMI greater than 35. They can be, once again, a related individuals like parents or siblings, or children, or they can be unrelated like friends, spouses, or colleagues and church members. How they can do so is by going through an online screening as the first step in the evaluation process. If there are no formal barriers, then we can move on with our evaluation. They get an evaluation that we can minimize any potential risk for them. So what does this actually entail? So the donor actually submits a living donor application via the www.utsouthwesternlivingdonor.org, also known as BREEZE. And this can be submitted anytime during the recipient's evaluation, which means that if the recipient is here today to be waitlisted, a potential living donor can apply on the exact same date. The donor evaluation does not begin until the recipient is actually approved for placement on the waitlist. Evaluation consists of testing and some consultations. Once completion, the results are presented to the Kidney Transplant Selection Committee for decisions, which could be approval, it could be declined due to either medical issues or other issues, or it could be deferred if the workup is incomplete at the time. If approved, then the transplant and donor surgery are to be scheduled. Now, it is very important to us that any potential living donors also have confidentiality. We are committed to maintaining the confidentiality of both you and the recipient and your potential living donor. The donor and the recipient will have a completely separate team, and no information will be shared between the donor and the recipient team. A donor cannot be pressured for donation, and of note, we have to mention that organ donation must be a voluntary act on the part of the donor. We do realize that there could be quite a bit of financial impact for the potential living donor. All services that's related to the donation will not be billed to any potential donor. It will be billed to the recipient's insurance. It is illegal for any potential donor to be compensated or paid directly or indirectly by the recipient or recipient's family or any other party for donating a kidney. Donor assistance funding may be available to help cover some of the costs of travels and housing, especially if you're living a little distance away from the transplant center, based on income through the National Living Donor Assistance Center. Now, we do recognize that asking for this help may be an uncomfortable situation and offer the following suggestions. Make the need for your kidney transplantation known to family and close friends. And we ask that you can do so by sharing your story about your kidney disease and the wait time for a kidney transplant in Texas. Share some of the advantages of living donation, which we had mentioned earlier on. The better results, much more prepared timing. Consider each potential donor's personality and decide the best way to approach them. Sometimes it is just better to share your story, and if they are interested to find out how else they can help, you offer them a contact with us at UT Southwestern. You have to assure the potential donor that he or she is under no obligation to donate and that his or her decision will be in no way affect your relationship with them in a negative manner. And always, the final step is potentially finding what we call living donor champion, which is someone that can be a cheerleader on your behalf if you're a shy individual or does not know how to share your story. This individual will be the one that knows your story, knows what having kidney disease is like, and how to potentially share your story with them through the process of going through a kidney transplantation and living donation. Do allow the potential donor to have time to think about this. They have to talk to their family member because it is a big decision before they come up with their final decision. Don't attempt to pressure anyone into saying yes. If the initial decision is no, we can always just leave on from that moment on, and if they're interested in the future, they will always approach again. Encourage anyone who may be interested in donating to contact the Transplant Center to ask any questions and to learn more about the process. One of the most important things to do when talking to someone about living donation is to offer education. Should there be any other questions you have, our Transplant Center will always be able to provide you with more education. Additional education materials can be also found on our website at utsouthwesternmedicine.org/transplant. And you can click on the programs, then on Living Donor Kidney.